Well, our next conversation certainly isn't an easy one, but it is important. Hospice care is a type of health care that focuses on a patient's comfort, attending to their emotional and spiritual needs at the end of life. They are often referred to by families as angels who help them through their most painful moments. This morning we want to talk more about those services to make sure that families in our area are aware of this invaluable service. Pamela Kowalski, clinical liaison for Avalon Hospice, joins us now with more on the different services that are provided. Thank you so much for being here.
Absolutely. Good morning.
Yeah, certainly a very serious topic, but hospice is so important for so many families. And let's kind of talk a little bit about what that means when it comes to health care. What is hospice?
Well, hospice is a very unique approach to health care in that the primary focus is on the individual and their family unit rather than their disease process or their illness or their condition. Real simply put, hospice is holistic end-of-life care, and of course the ultimate goal is for quality of life and comfort and dignity.
And you say we have all these plans put in place when a child is born, but then the end of life, we should also have a plan.
Absolutely. We like to say that our care matters, and when time may be limited and it's extremely precious, all that love and plan and caring, most of the time that goes into the beginning of life. With the hospice philosophy, we believe that the person nearing the end of their life deserves all of that, and hospice teams come alongside that individual and family to help provide that.
And it's really an intimate setting, being part of that moment. And I know that's something that you guys are professionally trained for, but also have a special heart for.
That's right. Yeah, very much. And we like to call that a hospice heart whenever we bring folks in to be a part of our team. And that would bring us to, the folks that provide hospice, and that would be everybody that's on the care team would be a physician, so every individual and their family is given a care team that's a physician, a nurse's aide, a social worker, a chaplain, a counselor, volunteers, and all of those people have been specially trained for end-of-life care.
What about cost for hospice? So it's a lot of different people that we're pulling together.
That's right. And actually, we have the Medicare hospice benefit, most Medicaids, private insurance, veterans insurance, and most of the time that's covered at 100%. So there's no co-pays or anything like that. And then for that coverage, that includes the entire hospice team and all the medications, medical equipment, and supplies that are related to their hospice care.
And I know for you guys, being part of those communities and making that service available is so important.
It absolutely is, and we're very dedicated to our communities and doing community outreach, and would love to hear from folks if they would like to volunteer to be a part of a hospice team, and we serve your entire viewing area.
And you have offices, so you have an office in Johnson City, but serves all over, so you can get them to the right offices if they need some assistance.
We do. We have all three Tri-Cities areas have offices. They're all through all 95 counties in Tennessee and even into Virginia.
Okay, well, Pamela, thank you so much for what you do, and certainly, like I said, such an important topic. We'll give everybody the information. Here is the information on Avalon, and you can call that number to learn more about the different offices and how they can help families in your specific area. Check out their website as well.